You know, I'm all about the D. Now let me show you the research about the D. This article came out in the Journal of Midlife Health in June 2019. And this particular article is talking about vitamin D and the pelvic floor. And it is a meta-analysis, which is pretty sexy when it comes to research. So this particular article is talking about the vitamin D status in women with pelvic floor disorders, which I've been talking about for a while. So if we start at the top, here we go. Pelvic floor disorder, the major clinical problem in postmenopausal women includes pelvic organ prolapse, urinary incontinence, and fecal incontinence. More than 24% of non-pregnant women suffer from pelvic floor dysfunction, which almost doubles by aging, with this prevalence being 36 to 49% after the age of 60. Pelvic floor dysfunction might be significantly associated with other comorbidities and affects a woman's quality of life. So let's keep reading. Vitamin D plays a critical role in bone growth and preserving bone mineral density. The current evidence has shown that less concentrations of vitamin D are correlated with reduced postural stability and increased risk of falls. The prevalence of low vitamin D status among postmenopausal women worldwide has ranged from 1.6% to 86%, depending on the region. However, earlier studies demonstrating the impact of vitamin D on skeletal muscle strength and function are inconsistent. So they looked at 7 studies, and in these studies they found the association between vitamin D levels and pelvic floor dysfunction among women. Their findings are that vitamin D levels was significantly lower in cases with pelvic floor dysfunction rather than healthy women in the control groups. So they go on to say that because vitamin D correlates with muscle strength, they're telling you that the pelvic floor muscle is composed of skeletal muscles, which is affected by vitamin D levels. There was a longitudinal study, though, that found that the consumption of a higher dose of vitamin D was significantly correlated with a lower risk of overactive bladder. And then they found that urinary incontinence symptoms, but not the fecal incontinence, was less common in vitamin D sufficient group, even after controlling for the demographic factors. So the D matters for the vagina. So they are coming out here and making this bold, sweeping statement that vitamin D deficiency is a precipitating factor for pelvic floor dysfunction in postmenopausal women. Now, postmenopausal is very different than perimenopausal. So we're going to get into the conclusion of the pelvic floor and vitamin D, but the physiological function of the pelvic floor can be modulated through improving vitamin D status. So their conclusion, the meta-analysis revealed vitamin D status is significantly compromised among women diagnosed with pelvic floor dysfunction compared to healthy women. Additional studies need to be seen, yes, but for right now, take your D3 if you have a pelvic floor.